Thank you, Deputy President. Deputy President, we are at a watershed moment for aged care in our country. After 4 years of work across the first term of our government and now, we are at a point where we are about to usher in a historic new Aged Care Act, the first in a generation, a generational reform, not only for millions of Australians now, but for our future selves. This work has incorporated the voices of older Australians, peak bodies, aged care providers, and unions representing those precious workers, those people who are at the front line, up close and personal, providing that care to older Australians, both in residential aged care facilities as well as their homes. We pay tribute to those workers. Now, the Coalition claims that we did not co-design this, but they put in the caveat that we should have co-designed this with them. In fact, they did provide support for this work. There's bipartisan agreement that we need major reform, a complete overhaul of aged care in our country, and we thank them for their support. But on the notion of co-design actually happens with stakeholders. It happens with the people the Act is meant to support. And at the heart of this Act is a statement of rights, a statement of principles that recognises that older Australians have a voice, they have autonomy, they should have a say, and we absolutely should prioritise their preferences because this is about them. And this is a key piece of information, a value that was missing in the previous Act. Now, this reform, Deputy President, cannot come at a moment too soon. It can't happen in a moment too soon. We have in the rearview mirror, but looming large, with a long shadow over this work, the Royal Commission into Aged Care, which in 2019 released its interim report. And you know what the title of that interim report was? It was Neglect. Neglect, writ large. It's an indictment on the aged care system that we inherited when we came to government. The quote in that interim report was that this was our aged care system spoke of a shocking tale of neglect. It had, quote unquote, designed neglect into the system. Can you believe this? Such an important safety net for all Australians, underpinned by the principles of care, had neglect designed into the system. And it spoke to systemic failings throughout the system, chronic underinvestment, a lack of standardisation of care, the complete disregard of the importance of that workforce. Now, I've spent my whole career before coming into politics in medicine, 30 years, 30-year-long career. And there is no care, whether it be in healthcare, disability care, aged care, childcare, without the workers. The workers are everything. The workforce, that workforce, care workforce, is mission critical to the functioning not only of these important service sectors, but to the functioning of our country. And that was evident during the pandemic. So while I was wrapped up in PPE from head to toe, working at the Alfred on the front line, how do you think I felt and my colleagues felt, the nurses, the aged care colleagues, not the allied health professionals, I beg your pardon, physios, OTs, pharmacists, junior doctors, senior doctors. How do you think we all felt when the then aged care minister, Senator Colbeck, was found at the Ashes watching cricket when he should have been fronting up to a COVID inquiry? Meanwhile, we had a flood of older Australians coming through the door, gasping for air, drowning in their secretions, in their lungs. They were delirious. They were completely disconnected from their families. So you can imagine how much trauma those patients experienced and how much, honestly, trauma we all experienced. I can barely speak about this time because It is so traumatic. I have pretty much buried it and concreted it over. There's a real moral injury for a lot of those healthcare workers who worked during that time. But as awful as it was for us in the front line in hospitals, it was much, much worse for those aged care workers who were dealing with this in the aged care facilities. Much, much worse. We even in Victoria had to send the army in to support the workforce. There was a complete collapse of residential aged care. So you can imagine that the first bill we passed as a Labor government in 2022 was actually on aged care. And we had to do that because the system was in crisis. And the word crisis is overused. It is thrown around in this place far too casually. But this was a real crisis. People's lives were hanging in the balance. Families were shattered, unable to reach their parents, their loved ones. We had a workforce that was leaving in droves, decimated. And I don't think we speak enough about the workforce, but I do. Because standing up for that workforce is how I ended up in politics. They are the group of people that I fought for, and that's how I ended up here. Now, my experience as a general physician at the Alfred was a daily ward round, which started in the emergency department and then worked its way up through every level of the hospital. In train was an entourage of junior doctors and a pharmacist and allied health professionals. Healthcare is provided not by an individual. It's not just by me. I was the boss. I made the tough calls, but it's provided by a team of high-performance individuals. And we started in the emergency department, and our workload was, the majority of that workload was older Australians. Older Australians with a whole catalogue of problems. Frailty, you don't get into hospital, usually unless you've got major problems with frailty. Social isolation was common. Many were grappling with the loss of independence due to overlapping morbidities, comorbidities. So multimorbidity is the norm when you have multiple health problems. It's not just one anymore, it's many. It might have been heart failure, COPD, which is like a type of emphysema, diabetes, cognitive decline, dementia. All of these things interact so that by the time a person comes into hospital, particularly during that COVID period, they may even have delirium. So that delirium is not just confusion. Delirium is a lethal condition, which is a predictor of mortality. And the longer it goes on for, the worse your mortality, the higher your mortality. And it's very difficult in a hospital to manage delirium because hospitals are chaotic places. I also experienced a lot of interactions, obviously, with families. And what was evident was carer stress. Carer stress was writ large. It was an issue that was very much gendered, and the burden was borne disproportionately by women. Often spouses, partners, but sometimes daughters. And during the pandemic, this was all, I have to say, from that 2019 to 2022, that this was all turbocharged. So our time was spent on the ward round, seeing patients, but then getting on the phones and trying to reach loved ones just to convey to them what was actually going on with their families and with their parents. Another observation I would make is that the decision to enter residential aged care is not an easy one for anyone. It's not easy for the patient, even if they have lost their faculties. It's certainly not easy for the families, because the families carry a great deal of guilt. They feel guilty that somehow their parent has to enter aged care. And what I found was that people will generally go through a fairly long phase of recurrent admissions to hospital before the penny drops that they actually aren't coping and they need to go into residential aged care. Falls, delirium, sepsis, so on and so forth, until it is evident that coping at home is no longer possible. So there's a very long period, a pre-contemplative phase that people will go through before that decision is made. So one of the first things we did when we came into government in 22 was actually try and lift standards in residential aged care and rescue that workforce. And so what we did was pump 18 billion into the aged care workforce with successive wage rises. It does mean now that registered nurses are $430 better off per week and carers around $320 better off a week. In some cases, that's a $17,000 per year wage rise. It's phenomenal. But it's had the effect. It has arrested that egress of workers from the sector, arrested it. We're now also seeing much lower vacancy rates for these sorts of positions in aged care. And honestly, aged care, it's a profession. It should be seen as a profession. The aged care facilities that I visited when I was in the lower house, in my own community in inner Melbourne, were very much a real tribe. There was a sense of camaraderie and pride in the work that they were doing. That's exactly what we want to see, because when people have pride in their work, quality follows. Quality follows. What we also did was, of course, introduce food standards to try and make the food in residential aged care more appetizing for people, noting that many of them will have swallowing difficulties or other such issues. And so that can be a challenge. We mandated 24/7 nursing, and now a registered nurse is on site in aged care facilities 99% of the time. And what does that mean? It means that a nurse is there to basically call up a doctor if there's a problem, prescribe medications, sometimes even manage the palliation of a patient without loading them onto an ambulance, sending them into a hospital, enduring a busy, chaotic emergency department, and then going up to a ward for more chaos. Hospitals are chaotic places. People get shuffled around like chess pieces from bed to bed. Alarms are constantly going off. Emergency calls are constantly going off. And this is extremely overstimulating and bad for elderly Australians. It actually leads to delirium. Not to mention the fact that they end up basically stuck in a room, stuck in a bed, and then they decondition. And it's called PJ paralysis. That's not a medical term. PJ paralysis refers to pajama paralysis. So as much as possible, we try to keep people and manage them in their residential aged care facilities, and there are mobile teams that are often deployed from hospitals to do that. We certainly had a dedicated team. Other major health networks in Victoria do have these. But we're now going a step further. We're trying to actually fulfill the wishes of older Australians to remain at home. And so on the 1st of November, a new act will begin that will usher in support at home. With that will come an additional 83,000 or so home care packages, on top of the around 300,000 home care packages that are distributed. This is double the number of home care packages we had 5 years ago. So there has been a steady uplift. There is a waiting list. We know that. Waiting list of around 120,000 people awaiting an assessment. Looking at the data, which I had a look at from the Department of Health during the inquiry last week, the median time for waiting until you are assessed to get a home care package is around a month. In Victoria, the median time in some places is about a week. It's not a prolonged period. And actually, that timeline is coming down. So and I thank those assessors. They are often aged care teams that are positioned in the community who go out and do home visits. Sometimes it's done by phone or via telehealth. We know that the need is urgent, and it's not acceptable to have older Australians dying at home, as we heard last week, while waiting for a care package. We know that it is not acceptable. It reflects how broken this system is and why it is so urgent that this Parliament and this Senate pass this bill. We are completely overhauling this system and at the heart of it are the wishes of older Australians. It is a generational reform that we will reap the benefits for years to come. Thank you, Speaker.
Senator Brown.